Dr. Saqib Nakadar is a Detroit area native and has been practicing medicine since 2008. He worked for Henry Ford Health System at Henry Ford Wyandotte Hospital. Throughout his years of practice, he has developed a unique understanding about health and symptoms that affect patients on a daily basis. He started a separate clinic in 2010 where he focused on lifestyle modification and a holistic approach. He became familiar with medical cannabis and started to focus his interest in this area. He now has a vast knowledge of the plant, cannabinoids, processing, dosages, and practical applications. Dr. Nakadar has become one of the leaders in the medical cannabis field. His clinical experience, medical knowledge, and treatment of thousands of patients has given him an excellent reputation. Medical professionals, lawmakers, regulatory agencies, and law enforcement have all looked toward Dr. Nakadar for his valuable input to various issues regarding medical cannabis. Outside of the medical clinic, Dr. Nakadar volunteers at the Hutter Clinic once a week. There he provides medical care to patients without insurance who are unable to afford medical care. He also teaches medical students on a regular basis. He is an associate clinical professor at 2 colleges at Michigan State University. Doctor?
Hello, everyone. Thanks for having me, Supervisor Cannon. I've done quite a few of these different town hall meetings in different formats and different situations. My role is usually explaining the science and some of the medicinal benefits of cannabis. However, I don't think that that's the discussion here today, and so I'm going to kind of switch over a little bit. I'm going to speak a little bit more as a father, a physician, a person in the community, and someone who has some of the same concerns that this community has. And I think one of the things that we do all need to understand is that there is a group of patients, as much as we want to maybe stereotype a certain group of people who use marijuana recreationally as a culture, whatnot, what have you. I'm not really here as an advocate for them, and I never really have been. I've never been for recreational or adult use marijuana. That's not what I speak for or advocate for. However, I do advocate for patients, and I advocate for responsible, educated use of medical cannabis. And I think that there's a place for that here in Clinton Township, along with other suburban communities here in Michigan. And I've been practicing for 10 years, seeing patients across southeast Michigan I have patients all the way across the mitten. And the reason why I do have patients is because there is medicinal value, right? So I do understand there are a lot of concerns, and I have some of those same concerns. Some of those that were voiced were about the high potency of cannabis and what those effects are and the effects of that on our community. The development of the brain, so that's actually a very important aspect that I think gets overlooked, and our adolescent brain really isn't something that I think we should be exposing cannabis to. And so using cannabis responsibly is really important, and some of the laws and the regulations and the rules that kind of go behind this are important for that reason, because we are still serving my grandma, your grandmas, our kids. There are kids with autism that use this in very severe situations. It just got approved for cerebral palsy, where it's been very effective. I've been using it for over 8 years. One of my first patients that was a young child I had in cerebral palsy, that patient's now become an adult and still using cannabis and very effective for them. So, and I can go on with the cases, and I know you guys are out there, and I'm not trying to sit here and advocate for that. But here's the situation. Again, I don't come from a business side. I don't come from any of those aspects. But I think it's really important to understand that every community has patients that use medical cannabis, and having them to drive to certain distances and go to surrounding communities. Yes, it's definitely an option. However, it's usually not practical. We have just like. The other attorney had spoke about CVS's and those things. I mean, they are responsible for a lot of the opioid spillage and things that happen. But I think education about diversion and understanding about what cannabis is and then the overall effects of it to our community is really important. And I think that's one of the things that, as a physician, I strive communities to implant into their ordinances, to have standards about its approach as a medicine, how they operate as a business. And a lot of businesses are here, and people are here that represent retail businesses and are very successful retail businesses, but aren't really experts at medical cannabis and treating patients. And that's really kind of what I'm here to do. And I do that in many communities, and we have done that successfully, where we've created different systems in the ordinances that allow for that stratification, bringing the best candidates towards the community. And again, it's up to the community to decide who those candidates are, how that's done, and how that is. You've heard about a lottery system, you've heard about these petitions and all these different things, and to be honest with you, I'm not here to advocate or push for any one of those things. I really kind of more prefer situations where the people are involved with the community, they're forced to engage the community in certain aspects, partner with the community, and those are businesses and operations that the community should accept and have in their operations. They are right, the regulations are going to be very strict. I've been part of making those rules. I set a lot of the lab testing standards and participate in a lot of those discussions about what those rules and things are, and they are very well placed. There's a lot of consideration in terms of diversion to kids and things that attract kids. I think there is a situation too with the recreational and adult use coming on board and what that presents. And I think the community also has that option to opt in or out of recreational, and that will really determine whether those facilities can be further licensed or not. And again, yes, it is up to your community leaders and the people you trust to make those decisions, and discussing those things with them here at this community meetings, voicing your opinions in other formats and forums is really what's going to bring the best of all situations, however you decide. And I think that's, for me, the most important thing is that patients have access. I have patients who are 6-year-olds and I have patients who are 96-year-olds. So all of them have different challenges, different situations that they deal with, and I think they just can't be ignored. But I do agree with both sides of some of the concerns. But again, education and keeping the proper regulations and standards can show statistics on both sides. So you've heard crime statistics go up, and you can probably see places where crime statistics are shown to go down. And those can be debated back and forth. But I think the one thing that really can be debated is how this helps patients and what it does. And if one of our loved ones needed this, how would we get it to them? People struggle with that on a daily basis, and it's been a struggle for 10 years that I've been dealing with. So I hope the community does really rise up and make the right decisions, help the community, as well as protect the community at the same time. Thank you very much.